We put this presentation to explore the vital aspects of public health and its significance in our communities. Let's first define public health. C.E.A. Winslow was one of the founding figures of modern public health. He defined public health as a combination of science and art, offering many opportunities for creativity. Public health is not only about preventing and treating disease, but it's also about promoting good health. Winslow says that this is achieved through organized efforts such as establishing national surveillance systems, developing waste management infrastructure, and communicating the latest vaccine recommendations. From Winslow's definition, public health provides individuals and organizations with information to make informed choices and improve their health or that of others. Public health operates at various levels: individual, organizational, and community, as well as on broader scales such as city, state, national, and international levels. Slide 3. Here are two statements about the mission of public health. The Institute of Medicine says that there is a societal interest in ensuring conditions in which people can be healthy. The World Organization defines public health as serving the greater good by maximizing benefits for the largest number of people. These statements prioritize the well-being of groups of people rather than solely focusing on individuals. At the core of public health lies the principle of social justice, asserting that people have the right to be healthy and to live in conditions that support their health. Key terms. Now let's review some of these key terms. First one is clinical care. Encompasses the prevention, treatment, and management of illness, as well as the preservation of mental health and physical well-being through health services. This is also commonly referred to as medical care or healthcare. 2. Determinant, also known as health determinant, is a factor that contributes to the development of a trait, such as one's ethnicity or genetic makeup. Broadly speaking, the context of people's lives determines their health. 3. An epidemic or outbreak is the occurrence in a community or region of cases, an illness, or a specific health-related behavior in excess of what is typically expected. Epidemic and outbreak are used interchangeably, although epidemic usually refers to a larger geographic distribution of illnesses or health-related events. Essentially, an epidemic occurs when a disease spreads rapidly to many people, for example, COVID. The term pandemic, which is akin to the epidemic on steroids. It has a global impact affecting on multiple continents, crossing borders into different countries. And last but not least is a health outcome. It is a result of a medical condition that directly impacts a person's life in terms of its quality or length. Now, we'll take a look at a few historical highlights of public health through the four lenses of sanitation and environmental health, pandemics, disaster response, and preparedness, and prevention through policy. Sanitation and environmental health. The first lens will explore encompasses the control of disease and promotion of health through sanitation to ensure healthy environment. Here we have 3 examples from around the globe of how public health has been implemented to contain infectious disease through environmental measures. Back in 500 BCE, it's recorded that the ancient Greeks and Romans actively practiced sanitation measures. Jumping ahead a couple of thousands of years, in 1848, the United Kingdom passed the Public Health Act. This law created a central group to look after public health and made sure that local areas were responsible for keeping things clean. In 1970, in the United States, the administration of President Nixon established the Environmental Protection Agency, which still today protects our health by safeguarding air, water, and land. Pandemics, which are like pandemics but on a larger scale, often affect multiple countries, continents. Influenza, commonly known as the flu, has caused pandemics numerous times throughout history, both in the distant past and more recently. Almost a century ago, the Spanish flu swept across the world, infecting 500 million people, even reaching remote Pacific islands and the Arctic. It's estimated to have resulted in the deaths of 20 to 50 million people. More recently, the influenza pandemic in 2009 spread to 214 countries, leading to almost 19,000 confirmed deaths. This is significantly lower fatality rate compared to the devastation caused by the Spanish flu. Despite significant progress in controlling influenza, preparing for and managing its effects will likely remain top priorities for public health. Polio was once a widespread and feared disease, causing severe illness, paralysis, and death. The introduction of polio vaccine in 1955 promoted thousands of people to get vaccinated in 1988. A global initiative to eradicate polio was launched due to outbreaks in over 125 countries. Thanks to this effort, polio now exists in only a few countries. Lastly, in the 1980s, the human immunodeficiency virus emerged and rapidly spread worldwide. Public health response to this pandemic and have led to the development of new methods for diagnosing and treating infected individuals. Over the past decade, new HIV infections have increased by 20%, indicating the success of public health interventions. And COVID. Preparedness for disaster response. Now let's look at the role of public health and preparedness in disaster response. Whether they're natural or caused by people. The use of biological warfare to affect people and animals goes back a long time. One of the earliest documented instances occurred during the siege of Kaffa in the 14th century. This siege is said that bodies infected with the plague were thrown into the city to spread the disease. In modern times, the public health community to respond to disease outbreaks by distributing medicines, medical supplies, and help whenever it's needed. After the 9/11 attacks, public health workers were there to watch out for any new health problems that might pop up. This also made sure that people helping out and the nearby residents stayed healthy. Public health also plays a crucial role in responding to natural disasters. After Hurricane Katrina struck in 2005, public health workers collaborated with disaster relief agencies to provide emergency services. Teams were dispatched to conduct surveillance for illness in among residents in affected areas and those relocated to crowded shelters. Health policy as a way to prevent health issues. We use different policies across various areas of public health to help society as a whole. Going way back to about 1500 BCE, Leviticus, a book in the Hebrew Bible, is thought to be the earliest written health code. It talks about personal and community responsibilities, including keeping clean, practicing safe sex, and protecting against contagious diseases like leprosy, which led to establishment of leper colonies. In more recent times, there have been big changes in tobacco laws. Rules have been made to ban smoking in workplaces, restaurants, and other health public spaces. To encourage people to quit smoking and to protect those who don't smoke from the harmful effects of secondhand smoke. Increasing taxes on cigarettes has also been shown to make people less likely to buy them. About 60 million Americans, nearly 1/3 of adults, and 1 in 5 children are obese. Obesity is defined as being 20% or more above a healthy weight of having a body mass index, BMI, of 30 or more. Policies like food labeling laws requiring physical education in schools and making healthy food and places to exercise more accessible in communities can all help prevent obesity. To sum up, public health work to prevent pandemics, stop diseases, injuries from spreading, protect against environmental dangers, promote healthy behaviors, and respond to disasters and outbreaks. Slide 10, the public health approach. The public health problems come in many forms, including infectious diseases, chronic illnesses, emergencies, injuries, environmental health issues, and various other threats to health. Despite the differences in topics, public health problems are approached in the same way, following 4 basic steps. The 4 basic steps. Public health approach. Firstly, we ask, what is the problem in public health? Surveillance systems are used to observe and track health events and behaviors among a population to identify the issue. Once we've pinpointed the problem, the next question is, what is causing it? We investigate to understand the underlying factors such as certain behaviors, environmental conditions, or risk factors that can make certain populations more vulnerable to the disease or issue. Then we ask, what intervention can help? We look at past interventions that have been effective in similar situations and consider whether they would be suitable for our population. Finally, we ask, how can we implement it? Considering resources availability and population characteristics, we determine if the intervention is feasible and likely to be successful. This approach forms the basis of public health problem solving, surveillance, identifying risk factors, evaluating interventions, and implementation. Slide 12, Public Health Core Sciences. To implement the public health approach, practitioners utilize scientific methods from core sciences. Number 1, public health surveillance helps monitor health situations. Number 2, epidemiology identifies disease origins, spread, and prevention methods. Number 3, public health laboratories confirm diagnosis and support research. Number 4, informatics handles health information effectively, especially with electronic records. Number 5, prevention effectiveness studies provide economic data to inform policy decisions. These sciences collectively empower public health practitioners to practice and promote health by providing necessary answers and responses to various situations or problems. Slide 13, cholera. Let's examine how the public health approach applies to this historic example. A fatal intestinal disease was rampant during the early 1800s in London, causing tens of thousands of deaths. Back then, it was believed that cholera was spread through bad air from rotting organic matter, known as the miasma theory. Slide 14, John Snow, the physician. He was a British physician believed to spread through contaminated water due to sewage dumping in the Thames River and cesspools near town wells. His research tracing the outbreak established him as the father of modern epidemiology and changed the way we look at diseases today. Let's apply the public health approach to Snow's research. Slide 15. Epidemiology. What is the problem? Well, firstly, we need to identify the public health problem. Snow conducted public health surveillance looking at where people with cholera lived in London, and he noticed large clusters, particularly around Broad Street. The red circles on the picture here represent where cholera cases were. Risk factor identification. Next, Dr. Snow analyzed data to identify risk factors. He examined the pattern of where cholera cases were occurring, focusing on the distribution of water pumps in London. His research revealed that areas near certain water pumps, especially The one on Broad Street had higher numbers of cholera cases. This led him to conclude that drawing water from the Broad Street pump was a risk factor for contracting cholera. Slide 17, intervention, evaluation. What works? The next step in public health approach is to evaluate potential interventions. Snow identified the water supply from the Broad Street pump as a risk factor and worked to address it. He did continuous research and identified two main interventions: stopping exposure to the contaminated water supply locally and on a larger scale, halting exposures to the entire contaminated water supply in the area. Slide 18. How do you do it? Implementation. And the final step of the public health approach. Snow removed the handle from the Broad Street pump to prevent people from using contaminated water. After a lengthy battle with politicians and water companies, the British government that contaminated water, not foul air, caused cholera. This led to the implementation of policies for water sanitation on a larger scale. Slide 19.
Hi everyone, my name is Romy and I'll be introducing the core functions and essential services of public health. So in 1998, the Institute of Medicine outlined 3 core functions essential for public health agencies: assessment, policy development, and assurance. Oh, next slide, please. So we start. In 1988, the Institute of Medicine outlined 3 core functions essential for public health agencies: assessment, policy development, and assurance. Assessment involves understanding what needs to be done based on data collection and analysis, which guides further action. Policy development extends beyond legislation to include guidelines, procedures, and regulations informed by assessment data. Assurance ensures that policies and programs are implemented by delivering public health services to those who need them. This aligns with the mission statement of the Institute of Medicine, which emphasizes assuring conditions for people to be healthy. Next slide. In this graphic, the 3 core functions, assessment, policy development, and assurance, are depicted on the outside of the circle. Below them are the 10 essential public health services, aiming to encompass the breadth of public health practice. The strength of a public health system lies in its ability to effectively deliver these essential services. Applied to tobacco use, for example, to tobacco use prevention, for example. Number 1, assessment involves monitoring health indicators and investigating risk factors associated with tobacco use, which providing data to inform policy development. For example, assessing the risk of developing certain cancers due to tobacco use. Number 2, policy development includes informing, educating, and empowering individuals about health concerns, leading to community mobilization, where advocacy groups work to rally support for policies like banning smoking in public places, and policymakers develop and enact policies to address tobacco use prevention, such as raising tobacco taxes and implementing age restrictions for purchasing tobacco products. Lastly, number 3, assurance includes enforcement of policies linking individuals to needed services, which is referring smokers to tobacco, to quit lines or counseling services, and ongoing evaluation to assess effectiveness. Next slide, please. The core functions of assessment, policy development, and assurance must be carried out at all levels of government for the public health system to function effectively. At the federal level, assessment involves conducting national public health surveillance on tobacco use. Policy development includes actions like banning smoking on commercial airline flights, while assurance is provided through federal grants for anti-smoking research and prevention programs, which are managed by agencies like the CDC. At the state level, states monitor tobacco use and have the authority to set tobacco taxes. For example, Proposition 99 in California funded campaigns to prevent smoking. Locally, communities report on tobacco use, develop policies such as prohibiting smoking in bars and restaurants, and provide resources like multilingual cessation support through county or local health departments. And honestly, each level plays a very vital role in implementing these functions and services for overall success. Next slide, please. The next section of this presentation is about into the roles of various groups who have a stake in public health. Next slide, please. A public health effort requires collaboration among stakeholders with diverse skills and resources, including intervention programs, policies, research, and education. Key partners include governments, community groups, clinical care providers, employees, businesses, the media, and academia. Other sectors and fields that play a role in public health include transportation, housing, schools, city planning, law enforcement, and faith-based institutions. These are often considered non-traditional partners, but efforts are being made to integrate them more seamlessly into public health initiatives. The goal is to adopt a health in all policies approach, recognizing that health outcomes are influenced by various factors beyond traditional healthcare settings. Next slide, please. Non-governmental organizations, or NGOs, play a vital role in public health, particularly at the community level. They serve various purposes ranging from advocacy and education to emergency relief and economic development. Examples of different types of NGOs include professional membership organizations, which represent specific professions in the health sector, groups that target specific health issues, and citizen groups that advocating for health-related causes, and foundations that support health projects and initiatives. The column at the right shows an example of each one of these types of organizations. For example, we have the American Public Health Association, the American Cancer Society, Americans for Non-Smoker Rights, and Bill and Melinda Gates Foundation. Next slide, please. While public health and healthcare play crucial roles in protecting and improving people's health, they have distinct focuses and approaches. Public health prioritizes population-based prevention strategies, while healthcare concentrates on diagnosing and treating individual patients. The guiding ethics for each area reflect these differences. Public health laboratories support public health professionals in serving groups of people, whereas clinic laboratories assist healthcare providers in serving individual patients. So if you look at column left, the population focus for public care is different from the healthcare because public care is population focused and healthcare is individual patient focused. Next slide, please. Other partners in public health include social media platforms, which have become important vehicles for public health discourse on different health issues. While historically public health agencies and traditional media outlets played a significant role in educating the public, social media now allows for more direct self-promotion and dissemination of health information. Employees and business also contribute to public health by providing health insurance and implementing workplace wellness initiatives. Government agencies such as the CDC collaborate with state, local, and even tribal health departments, while other governmental departments at all levels, like city planning and education departments, integrate health considerations into their policies. This approach, known as health in all policies, emphasizes the importance of considering public health implications in all decision-making process. Academia plays a crucial role by educating and training the public health workforce, conducting research that informs public health initiatives, and contributing valuable knowledge to the field. Next slide, please. Now let's explore the careers of public health. So firstly, public health nurses play a vital role in monitoring essential health indicators like illnesses caused by the environment, levels of immunization, rates of infant mortality, and occurrences of communicable diseases. This monitoring helps identify health issues that pose a threat to the public and allows for the development of effective interventions to address them. They achieve this through advocacy, education, and providing direct medical care. Secondly, public health administrators uphold rigorous health standards, help set up and run treatment programs, and oversee organizational finances. They also provide supervision to other leadership teams within the organization. They ensure the smooth operation of public health organizations by overseeing staff, finances, and programs to ensure the effective delivery of public health services. Thirdly, community health workers serve as a bridge between the public and healthcare providers, offering resources, information, and assistance that enhances health outcomes. Lastly, health educators design and implement programs aimed at promoting the prevention of illnesses and the adoption of healthy lifestyles within local communities. Next slide, please. In this section, we'll delve into the determinants of health and how they impact public health. Next slide, please. So these determinants generally fall into 4 categories: genes and biology, health behaviors, social or societal characteristics, and health services or medical care. Examples of genes and biology include factors like sex, age, and immunity levels. Health behaviors encompass habits such as smoking, dietary choices, and adherence to prescribed medication for chronic conditions. So social or societal characteristics involve factors like employment status, educational opportunities, neighborhood environment, including air and water quality, and access to sanitation facilities. Examples of health services or medical care include insurance coverage and proximity to quality healthcare facilities. Healthcare expenditure represents a significant portion of the United States budget, but it's not the primary factor determining our health. At the population level, social and societal characteristics play the most significant role in determining health outcomes, followed by health behaviors. Genes and biology have comparatively less influence. And yeah, so next slide, please. The health impact pyramid outlines various types of public health interventions and their effectiveness. Individual level efforts like counseling sit at the top with limited impact but high effort. Below are interventions altering environments to encourage healthier choices and clinical measures for long-term protection. At the bottom of the pyramid are social economic interventions, which have the broadest impact with less individual effort. While all levels of the pyramid are important, interventions at the lower level tend to be more effective in achieving sustained public health benefits. And in some cases, counseling and education are the sole interventions available. And when consistently applied, they can yield positive outcomes. Next slide, please. So this is an example of each level of intervention. So as the pyramid increases, so does the individual effort needed. For example, counseling and education would need more individual effort than making healthy decisions at default because they're higher on the pyramid. However, as the pyramid decreases, the public health impact actually goes up. For example, the public health impact is higher for poverty education and poverty reduction in education than tobacco warning labels, which promote quitting smoking. Next slide, please. So let's recap what we went over. So we went over the purpose of public health, key terms using public health, prominent events in the history of public health, core public health functions and services, the roles of different stakeholders in the field of public health, determinants of health, and individual determinants of health affecting population health. Next slide, please. So thank you so much for listening, and we hope you learned something new about public health today. Thank you.
Thank you, guys.
Yeah, thank you so much for that amazing presentation. I loved how thorough it was, and it was clear that you guys put a lot of effort into it. And yeah, thank you for going over like historical situations where public health is needed, and then bringing us back to present day where we can see how all of these situations apply. Romy, did you have a question?
Oh,
Okay.
thank you for your kind words. But at the end of the presentation, we actually had our references. So I just want to like make that known that like we have the sources where we got all of our information from.
Okay, yeah, let me share that one more time.
Yeah, and these are our references where we got all of our statistics and information from.
Yeah. Yeah, thank you. That was amazing. But other than that, I think our session today is over. So you guys are all free to go and have a good week.
Thank you.